name is Dr. Kelly Baquet.
My name is Blake Lagarde.
I'm Gloria Javertano.
I'm Dr. Shannon Fingstag.
I'm Dr. Demetra Smith.
So the advantage of getting a DNP for me was I felt really prepared when I was in the clinic by myself.
I believe that what differentiates a DNP versus an NP is that ability to really actually look at the research.
When you graduate with a DNP, you're prepared not only to be a clinical practitioner, but to be a leader in healthcare. You're prepared to do quality improvement projects. You're prepared to start practices.
The DNP opens up doors for various things in leadership. One of the things that I'm proud of that I was able to help implement and to be a part of their creation process is that we're actually starting a maternal task force.
In coming here as a midwife student, if you were interested in a certain study or wanted to participate in it, we always have openings for data collection or data analysis, or just getting your perspectives. And sometimes, because you're in the front line, you're at the clinical sites, and you see things that we can use as clinical problems for our next study.
You know, there are some really good reasons to choose a nurse midwifery program that ends with a doctorate. Even though the doctorate is, it's a little bit more academically rigorous, it may take a little bit more time, but it prepares you to really be a transformational leader. It prepares you to develop the solutions, to be part of the policy that and the advocacy that leads to really making changes.
When we shifted back to in person, and you actually are communicating with your peers, you have a shared learning experience.
What I liked about LSU was the fact that we were on campus. You could go to your teacher's office if you had any questions. You had time to meet the teachers. You had time to go over the syllabus. You had time to like hands-on be able to touch them and tell them, this is what I need, this is what I want, this is what I'm looking for. And also when you're looking for clinicals or you have questions about what type of clinicals, or they help you with that. They actually find your clinicals for you. So that was very helpful. I have a lot of friends who are in MP school, and that's one of their biggest problems. They're trying to find a clinical place to go and do their hours, and that's a big struggle, and you don't have that at LSU.
I think that there are many pros to doing an in-person learning. The first thing is that the camaraderie that you build with your peers, that you have you can build study groups, you can build friendships that last, and so you have something a support group to fall back on.
Nurse midwives are advanced practice nurses. We are educated in the disciplines of nursing and midwifery. So that means that we sit for a licensing exam, we sit for a national certification exam. Nurse midwives are licensed to practice as advanced practice nurses throughout the country. We provide care during pregnancy and birth, but we also provide GYN care, newborn care, and we're primary care providers. We don't have a lot of nurse midwives in the state. We don't have a lot of nurse midwifery practices. We have a lot of obstetric care that needs to change, and as nurse midwives, we're going to have to be the change makers.
Able to build community. I've worked in various hospital settings with various nonprofits and community organizations, and so you do build that network and you do understand the dynamics of the patients that we see within Louisiana.
I've built a community in Louisiana, in New Orleans. And I feel like I understand I understand what it means to be from Louisiana. I understand what it means to provide health care.
The instructors here are outstanding. They're living examples of systems level change.
So I think my DNP really prepared me to be a clinician by myself in my own clinic and have to figure out those things on my own. So I felt prepared.